Yep.
Oh, good. Yes, it is. Looks like we have a great turnout, so.
So she is one of the policy folks, but she's primarily assigned to they're calling livability,
Get
but
the
I
notes
call
and-
homelessness and sweeps.
Yes. That sounds about right. I know this city is such a trip. I mean, I gotta say, as a community manager, watching this shit's kind of crazy. It really is. Drive around Boston with these people that like somebody corporate can go to and
Yep.
and then they start calling it livability.
Yep.
It's like you didn't call it livability in the 80s, for sure.
Right. Right.
You know.
And like this first like
To the meeting tonight. Really happy to see such a great turnout. I'm Judith Mowry, and my day job is working for the Office of Equity and Human Rights, and I'm really pleased to be able to lend a hand for facilitating some meetings when they come up for the mayor's office, so I'm happy to be here with you all tonight. The meeting is scheduled to run from 6:30 to 8:30. If everyone didn't notice, if you go down the hall to the right, that's where the restrooms are. There are snacks. There's coffee, decaf, and snacks. Please feel free to use them. Everyone take care of whatever your needs are as we go. So we have two different panels this evening. So we'll be doing some panel discussion, some time for questions and discussion. And then I think, that will do it. That's where we're going to be. So I really welcome everybody today. And I'm super excited to invite the women who are here on this panel because they all do incredible work and of great service to the community. So I will just go down to tell you who they are, and they will explain some of what they're doing. I've been reminded to please define acronyms, and I'm going to do my best to remember that. But if we say something you don't know what it means, just wave your hand, okay? We want everyone to be able to understand everything that we're all saying. So Sharon Singleton is the executive director of Join, which is... Shannon.
There's a Shannon and a Sharon.
Thank you.
It'd be very confusing.
Okay. That one at the end. No. Shannon is the executive director of Join, which is an incredible organization I personally have a lot of respect for. Commissioner Sharon Marin is, of course, our county commissioner, who was just elected in this last round, and excited to have her here. And Erica Armsbury is from Central City Concern. So we have some women here who are very deep in the work and have a lot of perspective to bring to all of us. So I'm going to turn it over to Shannon just to give us a little snapshot to get started in our discussion.
Great. Thank you. I'm really terrible with microphones, so if I get too close, let me know. So Join has been around for 26 years. We have been doing street outreach and housing placement for the past 23 years. We have a team of 8 outreach workers who cover the entire city of Portland through to East County and into the city of Gresham. So a huge area for a small number of folks. This team really works to connect with people who are sleeping outside or in cars and helps work with them towards whatever their housing goals are. We have a number of different resources available to us. Some are long-term vouchers that will give them permanent rent subsidy. Some are local rapid rehousing dollars, which are generally shorter-term rent assistance for maybe 3 to 6 months. In addition to that, what we do is have another team that we term InReach, and this team goes to sites like Dignity Village and Right to Dream 2, and some of these more alternative shelter sites that aren't really facility-based, but are operated as safe spaces for folks to sleep. What we do there is, again, connect with people and really meet them where they're at, ask them how they want to solve their homelessness, and work with them on their path to going back into housing. For both of these programs, what we have then on the other side of once you move into housing is we have a housing retention team. And so this retention team really works with folks once they move into housing to help them connect with other community supports if they need, to connect with employment or Social Security income if that's what they're looking for and need. Excuse me, a much more kind of traditional case management model that is about linkage and connection. But one of the bigger things that we do is really work with folks to reestablish a community of support. So at Join, we really believe that homelessness is a fault of lack of community and safety net and support. And so once somebody moves inside, we really want to focus on rebuilding that with them. And we do this through events or various groups. We're working on a really cool new project around peer-led support groups. Additionally, we have another team that is a collaborative that provides a higher level of service. So this team includes a mental health clinician, a mental health peer staff, an addiction specialist, and a healthcare navigator. And this is what you'll often hear referred to as permanent supportive housing. This team is really focused on providing those mobile in-home supports for folks who have a higher level of service need and want to engage in those types of services. Additionally, that team is able to serve folks who are in subsidized housing where there isn't that rent burden or the potential for massive rent increases that also often cause instability with some of our other households. We also operate a day center out at 81st and Halsey, and this is really, really about basic needs, access to hygiene, access to a mail service. We're a mail service slot for about 3,000 people, and many folks may or may not know you need an address to get your ID. You need an address to sign up for any sort of housing. You really need an address for just about anything, and so that's a really vital service that we're able to provide. We also partner with some places around laundry vouchers, which again, I will say is another basic need that folks have of how do they get clean clothes and clean their blankets and other things, particularly in our rainy season. Join really is focused on housing first. So our goal is to start with the housing. Let's find out where people want to live, how they're going to be able to afford rent, if we can find them a subsidy and get them inside. We truly believe, and research has shown, that this model is very effective when you can provide the wraparound services for people. But getting somebody inside first is really where we start to see a decrease in mental health symptoms, a decrease in use, and so oftentimes a decrease in that trauma that is the reality of homelessness, where folks really are able to engage in a way that I frankly don't believe they are all the time on the streets. Our biggest problem, to be honest, is the continued lack of affordable housing. It's really hard for us to do housing first in this community if we have nowhere for folks to move. So we also do a lot of systems and policy advocacy around this. I would say, I'll be honest, this is, I've worked in mental health services before as well. And just really believe that we've found some effective models to do this. I'd like to see us be a little bit more mobile and come into folks' homes and community to meet with them and support them in a way that doesn't have the expectation of showing up to multiple clinic appointments that can often be really challenging to navigate. And as always, that's about it for me. I had 5 minutes, but I really don't, I'm pretty concise, so.
Thank you, Shannon. Thank you. And so I'd like Erica and Commissioner Sharon to just introduce your program and a little bit about how the county interacts with services. And in this panel, we're really looking at mental health and addiction issues and how we address that. So another really critical provider in the community is Central City Concern. Can you tell us some about what you do in your model?
Sure. So one of the things I do have to say is when I do public speaking, I like to let people know it's not my favorite thing to do. But I really care about the work that I do and the topics that we're going to be talking about here. So I challenged myself. So I will say I can answer questions and speak to what Central City Concern does, for sure. I've been with the agency for about 10 years now, but I've predominantly worked in mental health. So I'm here representing the Old Town Recovery Center, which is the largest, sort of the mental health arm of Central City Concern. So I am the Director of Clinical Services, and we are located at the corner of Burnside and Broadway, which puts us right in the heart of a lot of action. And in that building, we serve only people who experience or live with severe mental illness. So we are currently serving about 950 people. 750 folks are enrolled in more traditional mental health counseling. We can see them once every 3 months, or we can see them once a week, depending on their needs. But the other population that gets talked about a lot is the folks that we serve in our acute services. And so that's about 260 people. Maybe I didn't do my math correctly, but it's about 260 people that we have slots for on those teams. 160 of them are in assertive community treatment, or ACT, which is an evidence-based practice model, and it's for folks who have a high crisis system utilization, meaning that they have state hospitalizations, civil commitments with state hospitalizations, interactions with Project Respond, or acute presentations at acute hospitals, including Unity. Then we have another team for folks who have been recently civilly committed. So it's a team called the Waitlist Reduction Program. And it's a program that serves to divert people either from the state hospital or folks who are currently in the state hospital but are ready for discharge and need some additional support. And then we have one more team, which is called an intensive case management team, and it uses a integrated dual diagnosis treatment model. And again, both of those teams, or that team in particular, also serves folks who have a high crisis system utilization. So again, most of our folks, I would say actually all of them, they would identify, and we would identify as having severe mental illness, meaning that they have their mental illness has significantly impacted them throughout their lives. And we provide an array of services. So we do mental health assessments, care plans, we do housing case management, we have licensed medical practitioners on site that do medication prescription, we have registered nurses that provides medical support, we have housing case managers, and about 50 mental health counselors, and we have a peer-delivered services program called the Living Room, where folks can come in every day but Thursday and come in and do a community meeting, get a meal. There's no requirement of a certain level of participation. They just come in. And what we had said many years ago was that we would rather have people come into our room, and if they're sitting by themselves, that's fine. I'd rather them sit by themselves in that room than sit across the street in an SRO. And that's been a really, really successful model going on about 7 years now. So.
What's an SRO?
Single room occupancy. Good job. Single room occupancy. It's the, you could probably explain exactly what that is better than I could, but there's a lot of the housing sites downtown are smaller units where folks live in what, I don't know if they call them efficiency units, but usually they might have a bathroom or very small, like the size of a parking lot or a parking space. But that's a predominance of the housing options that folks have downtown. And I should add that the teams on our acute services, they are small caseloads. They're anywhere, the ACT team, the Assertive Community Treatment Team, is a 10-to-1, 24/7 program. We write director's custody holds. We act as our own crisis response. And then the Integrated Dual Diagnosis Treatment Program is a 1-to-15. So those teams have a high level of flexibility to be able to respond to folks in the community. Our traditional outpatient folks, I will tell you, I was on the ACT team 10 years ago, and the folks that we're serving now in our traditional outpatient programs are the folks that I served on ACT 10 years ago. So that's one of the things we'll maybe talk about a little bit more later, is just a level of intensity that we're seeing in the context of mental health concerns in the community. And I think that's it. Yeah.
Thank you. And right before we move on to Sharon, I just want to say there are a few empty seats. If folks standing in the back would like to sit, please feel free. So, Sharon, will you introduce how you're engaged in this work?
Yeah. So, thank you. So I'm engaged in the work in a couple of different ways. One is that I'm actually an emergency room doctor, and I work for Kaiser, and there is so much that we see in the emergency department that involves people coming in mental health crises. And actually, that is one of the reasons that I ran for what is now my day job, my real job, which is Multnomah County Commissioner. And at Multnomah County, there are a number of roles that we play across our public safety continuum, and in terms of mental health care. And we do it both directly, so we provide direct services at the county. We also do it through contracting with a number of community partners. So, for example, JOIN, Central City Concern, are organizations that we would partner with at the county who provide services. And so we are connected in so many ways. So we are connected to the court system, including our treatment court programs. We have at our sheriff's office, they run the jails. They do some direct law enforcement in portions of the county. Our Department of Community Justice, and we have representatives from all of these departments here, so they can hopefully help me out if I'm still learning. It's been about 1.5 years that I've been a commissioner, but we have subject matter experts here as well. And they provide the supervision and programming, for example, for individuals who have been adjudicated in the court system or are exiting incarceration, for people on parole and probation. And then our health department plays a huge role both in public safety, corrections health, and so many people in jail actually are suffering from mental illness or substance use disorder or a combination of those. And they also do work that involves prevention and diversion in the community. They run our, community health clinics, and they also do a number of services that they contract with organizations with to do, for example, that intensive outreach on the streets and help with substance use treatment, et cetera. We at Multnomah County house what's called the LPSCC. It's LPSCC, and that is the local public. I always have to look at it because Local Public Safety Coordinating Council, and that's a really great group because it coordinates and brings together local criminal justice, people from the local criminal justice system, from law enforcement, from the courts, from the health department, from a number of different agencies to talk about policy in a coordinated and integrated way. So it's a way for these disparate groups to talk to each other, and that has a really beneficial impact on the conversation and what each of these individual groups might be doing. So we are a common thread through so much of these systems and touch points in the public safety system from prevention way early on, which is where we really need to focus, through re-entry. So it's a lot of what we do.
Thank you. Shannon, I'm wondering, you named, Shannon, that the lack of affordable housing is one of your biggest barriers and needs right now. And I'm wondering if either of the other two of you have anything that you would add to that in terms of what are some of the challenges that we have in the system?
Yeah, I would say I think it's not just a lack of affordable housing, but I think options that were once affordable are they're sort of taken off the market. I think that's one thing. I think the other thing is low barrier housing. I think one of the things I think is really important when we're talking here is that we're not talking about a homogenous group of people, and everyone's going to have different needs. And there's a set of people who need. At one point, I guess we still have it. We pay for a couple of units, and I call them the getting ready for housing units. And it's for folks who really aren't really, ready or able, and it might, be considered a housing first, but they're not really ready or able to attain something that's going to be longer term. And so we allow them to, have a unit where they can just settle down and stop the spin and kind of gain some ground. But something that's lower barrier for folks, I think, is helpful. Not just beds and not just money, but just some more flexibility.
And I couldn't agree more, both from what I see on the front line working in the emergency department and also from that policy standpoint working at the county, that housing is really the foundational, crucial piece of this whole puzzle that we're looking at. We just finished doing a deep systems analysis of how services are provided at mental health services are provided throughout Multnomah County, which we're releasing tomorrow. I'm very excited about this. It's quite a comprehensive evaluation and report, which will hopefully lead us to some next steps we can take to actually improve the system holistically. But one of the themes that emerged from that just came out loud and clear from literally everyone I think that we spoke with, and this is hundreds and hundreds of people, stakeholders, people with lived experience, providers, advocates, was the desperate need for housing. And, you know, as Shannon alluded to, you need housing first. You can't address your mental health needs if you're living on the street. You can't manage your medications. You can't go to therapy. You can't do all of the things that you need to do to recover if you don't have a safe place to be. Similarly, once you're there, it's very hard to maintain housing if you don't have those services that are attached that can help you be in that space and maintain that space. And so one of the things that we have focused on at the county with the city are what we call permanent supportive housing. And that is housing with the services attached so that we can help people, the most vulnerable, the people who so often fall through the cracks and end up in the emergency department, in jail, on the streets, stay in housing and be able to sustain that in a meaningful way. So we've committed to an investment in 2,000 new units by 20. I can't remember the date now. 2020. And this is in terms of use of our, public resources. This is one of the biggest bangs for the buck. This is where we really can make a difference and sort of shift the needle and help people get out of that most vulnerable state.
And I just want to jump in and add that part of why I say I do believe that the problem of homelessness is lack of affordable housing. We have many folks who live inside and are housed in our community who have addiction issues, who have severe mental health issues, and they are not homeless. While those wraparound support services are important, I think they're important and probably lacking for folks who are already housed as well. But when we're talking about homelessness, I really think it's important for us to focus on the housing piece of that.
Thank you. I know there is a balance, certainly in the public's mind, between personal accountability and addressing the root causes of homelessness and mental health, the lack of enough support for folks who are experiencing mental health challenges. And so I'm just wondering what you all in your experience, where do you think that what are the programs that work to address that? How do you perceive and build in this term accountability to help people be able to take more and more agency over their own lives?
So I struggle a little with this one because I'm not really experiencing a lot of folks outside who don't have accountability. Mm-hmm. We have people who are, I really do challenge folks to try and navigate finding food, finding a shower space, finding clean clothing, finding a space to sleep, getting access to employment, getting on housing wait lists, doing all the things that we expect folks to do who are sleeping outside while sleeping outside and often not actually sleeping. So this idea that there isn't accountability is a little challenging for me. And granted, again, I want to harken back to not everybody outside is this homogenous population. I think it's important to remember that we have folks outside who are working full time. They are often working multiple jobs. We have folks who are on a fixed income of Social Security or disability income who make $732 a month, and the average rents for a studio are $900. Those things don't match, and I would be hard-pressed to say that those folks aren't accountable. So I think that that's there. What we're missing, to me, is some of the connection and relationship between housed and unhoused folks to actually understand who it is that is out there and what we're talking about.
Thank you.
So I think that, I agree that is a very challenging question that I struggle with when I think about it. But I think when someone has committed a violent crime against another person, I think there is a firm line that when there is a crime committed, then people need to be held accountable for that crime. There is also, though, a recognition that many of the crimes for which people who are living on the streets are arrested for are, you know, these lower level, we call it crimes, that are happening as a result of them facing what Shannon described, those the situations that if I don't take a shower for 2 days, I'm like, I don't even feel like I could go out. I feel just, you know, and to imagine living on the street and feeling that way for months. And I went out actually with a street medicine group who goes to tent encampments, you know, in different places, and seeing how people are really living on the streets, but how grateful they are when they have any service that we can provide and assistance. You know, even it's so challenging to think that that criminalizing what they're doing is the right way to go. I think you know, some of the crimes that we see, for example, working in the emergency department, this happens all the time. I see people who come in who want help, who may be psychotic or scared or whatever it is that they're going through, come into the emergency department. We have a very high standard to put a hold on people and keep them, and that is, you know, we feel that they are imminently dangerous to themselves or other people. Imminent has been interpreted as like literally someone is going to walk out and shoot them, you know, harm themselves immediately. If they're not imminently dangerous to themselves or others, we are legally not obligated to hold them, and we don't have a reason to put them into an inpatient unit in the hospital. But sometimes people want to stay at the hospital because it's a warm bed, it's a place to get a meal, it's, you know, all of those things. And so we often, I mean, this is horrible. We call the police from emergency departments to trespass people and have them removed from the property, saying, we can't help you anymore. You know, it's time for you to leave, when people clearly aren't functioning well. So that becomes a crime, and then they don't show up. You know, maybe they're released on their own recognizance. Then they don't show up for, you know, this for their appearance, and a warrant is issued, and it becomes this vicious cycle that these are individuals who need housing, who need shelter, who need our support, who need mental health services, who need some of these other services that we don't have enough in our system of care, in our continuum, to be able to help these individuals. So the reason I struggle, what do we expect people to do? What would we do if we were in that situation?
So I will add, I was thinking about, I struggled with the concept of accountability as well, because I think there's somewhat of an implicit bias in the question itself about what we believe about people who are on the street. So I struggled with that, and at the same time I appreciate that there are crimes that are being committed, and there is this kind of sense of accountability. So one thing I did think of, because your question did ask about programs at work, one of my favorites is mental health court. What I see happen in that setting, and I've seen more successes than I have not, but what I do see is an opportunity that doesn't feel as punitive, and it allows for an opportunity for someone to succeed with support, and then it gets celebrated. And I think that just those experiences, and that I've had some folks in mental health court have, that's a really great example for me. I think that holds both.
And do we have that locally?
Yeah. There's
That
not
means by Multnomah County? Yeah.
there's not enough.
Right.
I think that's one of the things that I've definitely gotten feedback on, is that it's a great resource.
And then when people need the housing, though, then it's
Yeah. But is there someone here that can actually?
I believe Judge, not to put you on the spot, Judge Nan Waller is actually the mental health court judge.
Would you be willing to say a little bit about what mental health court is? And Mandy's going to bring you a microphone.
And sorry, my apologies for interrupting this important conversation, but just to remind everyone, we're on television tonight, and we're live streamed, and that's why whenever we talk, we have to have the microphone. So there you go.
Multnomah County has had a mental health court for a number of years. We do not have room for all individuals who are in need of mental health court. The criteria are that somebody needs an Axis 1 diagnosis, and then they have to be able and willing to participate. And there are some people who may not be able and willing to participate, so there's a willingness. The cases are staffed by the district attorney's office, a defense lawyer, the court, forensic diversion, and the Department of Community Justice for a determination as to whether people will be accepted into mental health court. And there are some very serious crimes that are accepted, but when people are seen as being both amenable to the kind of support that is provided by mental health court, and that they can be safely kept in the community, which is also another important factor, that they are going to be compliant enough so that it is going to be safe for the community to have them in the community. They're accepted. We see people on a very frequent basis, sometimes once a week. We do celebrate their successes, and sometimes the successes may be from other perspectives small, but they're important when somebody's been able to take a step forward and sometimes staying put at STP for a period of time is an enormous step forward when they've been on the street. And then there are instances where sometimes people are not following through, and as with any traditional court, sometimes then there is a sanction as a means of promoting continued compliance. Our goal is to keep everyone in and to have people graduate and move on. STP is, I'm terrible with acronyms. It's a shelter trans.
Neil's here.
Neil Rotman. About
Thank you. Neil. Say it again.
Takes a village.
And it's a wonderful program where people have it has some case management, and we would love to see more STP type models, more dual diagnosis programs. We could increase the population if we had more placement. Placement is often the biggest barrier to getting people out of jail. We don't have a place for them to be.
Thank you so much.
I also
Some
repeat what?
Stabilization to treatment.
in the mic. Say it.
Stabilization to treatment preparedness. And I just wanted to add, there also are programs that we're looking at the county, some innovative programs. For example, what we've done for substance use disorder is we have what's called the LEAD program, which is Law Enforcement Assisted Diversion. So many acronyms. But that is for low-level non-person drug-related offenses that people can be diverted when they are arrested by police. They can be diverted from going to jail to deciding that they will rather go into treatment and can be diverted in that way. And we are looking at some pilot programs of doing that for mental health situations as well. So if people, a police officer comes upon a person who thinks, that trespass is related to their mental health issue right now, or we need to figure out how that is determined, because we also can't have our police making diagnoses, but it's complicated. But ideally, if we're able to identify the right people and divert them to go to Cascadia Behavioral Health, to their urgent walk-in clinic so that they can get mental health services and get connected with treatment rather than going to jail, that could constitute a win. And so we're working on looking at those sorts of programs at the county as well.
Great. Thank you. It seems like now I've been around for a few decades. That's giving me a new perspective. And it seems like we have these pockets of very successful programming. It does, anecdotally, as an observer, seem like they're hard to grow. And I just wonder if anyone has any reflections on that, or, I know that we have had an increase in the number of people needing services, but I'm often interested in when things seem to be working really well, where the kind of the tipping point stops to actually really change the system in a more transformative way?
Well, that's something that I've been considering, and again, one of the reasons that I ran for Multnomah County Commission was looking at some of those issues of where are those transition points, and how can we implement policies that can help direct our resources to those more effective ways to address these underlying issues than people ending up in the least effective, most expensive places to deal with them, which are jail, the emergency department, et cetera. And that's one of the reasons that I pushed for this mental health deep systems analysis at the county, which will be released tomorrow morning. And there's a community event tomorrow night at the county building, 6 to 7:30 p.m. Looking at how those systems work together. It's one of the reasons that we have like LIPSIC, that the coordinating council getting together with these different groups and with some of the decision makers there to say, here's something that works effectively. Here's what we need to do more of. How can we grow this program? How can we do that most effectively?
Can I just real
Yes,
quick say, I think it's important to think about growth and replication. Sometimes we talk about growing programs where I think you lose some of the culture of what makes it good. And how do we replicate it, and how do we provide technical assistance so that other agencies can develop that expertise? Folks are often connected with somebody, and then we ask them to go to a different agency and connect with somebody new. How do we actually build on that trusting relationship that already exists and provide opportunity for people to get that with their worker that they already have?
Thank you. So now we want to open it up for questions and comment. And I'm wondering, there she is, back in the corner. I knew Mandy was there. If you'd raise your hand, Mandy will bring you the microphone. As she said, it's being filmed, but also not everyone's hearing is perfect. And it's great to be able to hear everybody.
Good evening. I'm Dan Handelman with the group Portland Cop Watch. And, years ago when truth-telling meant something, you could sue people for false advertising. This is not the first time one of these community forums has had a title that didn't match what was going on. This says, how does law enforcement interact with vulnerable populations? Commissioner Myron's the only person who's mentioned law enforcement so far tonight. So my question to all of you is, how do you plan to keep Portland police from shooting and killing more houseless and people with mental health issues, which is really what the PCCEP is supposed to help us with?
And if anyone has any reflection on that, the second panel is going to be much more tied to the criminal justice system, and we have people representing the police, the sheriff's office, and the district attorney. So that may be a better question for them, but does anyone have a response they'd like to make?
Well, I don't know if this is going to answer your question specifically, but it's a big question. I appreciate the question. I can say, as a mental health provider, I really, I can say I love the people that I work with. I couldn't imagine working with a different population. But it's also a population of people that most of them have had really significant interactions with law enforcement. Because I would guess that more than 60% of people in that building that I serve have had director's custody holds that have led to hospitalizations. So I can say that over the years, some of the things that we have done is that we have worked directly and closely with the Portland Police and have had multiple conversations about how to improve our relationships, and also we've participated in trainings for the Portland Police Bureau to give a better understanding and perspective. We have had even smaller group meetings. We have relationships with the Behavioral Health Unit. I think that there's definitely cultural differences between the Portland Police and the mental health system, but I can say definitely that there has been significant improvement over the years in understanding the complexities of both of our roles. I don't know if that speaks specifically to how we're stopping that, but I can say that a big piece of that is helping the Portland Police understand the context of the situations that we're in. I can say when I told some of my folks that I was coming here tonight, one person gave me, actually 3 people that I talked to, supervisors for my team, when I told them the context of the discussion, 3 people gave me examples of really amazing interactions that they had with police, including one person who had been wielding a knife, and they spoke with the police before they interacted with the client and said, "We have a very, very ill person here." And they said the tone changed significantly and said it was a really great and very, they were able to get the person to the hospital without incident. That doesn't always happen, but I think having improved communication and relationships with the Portland Police has made a difference. I also think that the shift from Portland Police to AMR doing transports has also made a difference as well. At least that's what I've heard from other folks. So.
Thank you, Erica. Anything else on that before we take another question?
I saw Philip first, then you, and I see folks on the back
Okay.
too. So
Maybe we're moving on. Okay, so Philip.
Hi, this is Philip. Thank you so much for sharing your expertise and your services. It's good to know that there are successful services here in Portland. One thing that I did want to bring up is a statistic that 40,000 deaf people are here in America, and the term deaf is an umbrella term. It includes deaf, deaf-blind, hard of hearing. So in Oregon, I believe there's 186,117 deaf people living in the state of Oregon, and there are no mental health services here for them. So one thing I want to emphasize why it is so important to focus on that as a priority is because 80% of deaf Americans have no employment due to discrimination. They're not able to move up in the job world. Communication barriers are one reason, among others, so it's quite a struggle. They also struggle to find affordable housing. Many of them end up on the street, and because of the communication barriers, they're not able to have access to services or take advantage of all the different programs, such as the ones that you're sharing. And mental health issues arise from that, and then interactions with the police arise from that, and it's a vicious cycle. And I have seen deaf people here on the street in Portland, about 15 that I've met myself, and I am just shocked at the state that they're in, and the stories that they tell me are just heartbreaking. They are the most vulnerable, most neglected population. So I'm just wondering, what are your thoughts on that and how we can improve that to make them a priority? If you were to hire a deaf mental health professional, how do you think that would impact those statistics? I just want to know your thoughts on that.
Yeah, I mean, I would say, one, I would come from the perspective of what does the deaf community want us to do? Is it hiring a mental health professional, but what other types of services are needed and more helpful and specific for that community? And I think that the vulnerability piece is very well heard, and I don't know that we've specifically addressed it in our Home for Everyone work. So I do think it's something that I would like to bring to the broader tables. I would say in the meantime, for me, it's not something that needs a year-long process to figure out, and so if there's something that we can be doing more quickly, I would love to know that.
And I too so appreciate your raising that question. And since you have first raised it with me and with the COAB, I say quickly. I think about that so often. It's something I have raised at the county. It's something I've raised in the context of. I mean, we need. Raising the awareness is so essential, just as a first step as we're trying to make an impact. And you're exactly right. When we, taking care of people, even in the emergency department, we have interpreters, we have translators for really, hundreds of different languages for obscure dialects. It's really quite amazing what we can do. But if someone who is deaf comes into the emergency department, everything comes to a halt. We are unable to take care. We are trying to find an ASL interpreter and wait for hours and hours and hours. It's shocking, and it's something we need to be doing absolutely in terms of mental health care, but I mean on a broader level as well.
Thank you, Philip.
I don't have much.
And I'm here after the meeting if you'd like to discuss further. I have a lot of ideas.
Yeah.
We can talk about that later.
And I don't have much to add except to say thank you for bringing it up. Over the years, we have had, I can say maybe 2 deaf or hearing impaired people on our community or assertive community treatment teams. And like Sharon said, we use interpreters, but I also know that when we use interpreters for any other language, we also know the importance of someone who's bilingual and bicultural. And I'm really surprised. This is actually the first conversation I've had about services for hearing impaired folks. So, thank you.
Thank you, Philip.
Hi, I'm Judy. So I just want to tell a quick story because my brother was severely mentally ill and had several interactions with the police and also had been to the hospital several times. And more often than not, he was turned away because he was not severe enough to be, let in, or whatever the word would be. And I find that the criteria is so extreme to get people help that my thought is that that criteria needs to be shifted. Because I understand the civil right of not forcing treatment on people. But my brother, who was not getting treated, he was not, he was so severe that he did not want to take his medicine. And so one time the police came out and he ended up being tased several times. So what is deeply upsetting to me is that his civil rights are being somehow protected by not forcing treatment or providing treatment in a hospital environment, but yet his civil rights, he's being physically damaged by police officers who are, being physical. And I mean, we've seen the stories, right? The guy that got stomped to death by police officers who was mentally ill. I'm sorry, I didn't remember his name.
Yeah, and let's when one person's speaking, let them have their time. Thank you.
Anyway, it's not a new problem. It's been around for a while, and so I guess my question is there any way to soften that criteria? I mean, my brother talked about getting a gun. That wasn't enough. That wasn't enough, and I don't understand that. He did talk about hurting other people, killing himself, and yet somehow it's like they have to actually act out in a dangerous manner. So then the violence has already happened, and somebody's already hurt before anything gets done, and that seems so wrong to me. Can we change the criteria? Is there any? I mean, I know it's a civil rights issue, and I know it's probably. I just wanted to bring that up as a thought.
It's something that is it's a very important thought, and it's something that I think a lot of people, particularly family members and other support systems for people with severe mental illness, experience. And it is a state. It's a state issue in terms of where the actual statute lies. But I think that there is getting to be a critical mass for having that conversation and recognizing that if you want people to be in the least restrictive place possible, that sometimes maybe insisting on medications or whatever is least restrictive than putting someone in the state hospital for 3 months until, they can, or
Or in
putting them
jail,
in jail.
because
or
my brother
putting
was
them
also put into jail.
exactly.
Walking
And
around.
so,
He's in no shoes, right? He's
Right.
walking around. He's
Right.
They take him to jail in his socks.
and sometimes, and I've seen that people die on the street. And so I don't think people should necessarily have the right to die on the street if they don't realize that that's going to happen. That's my own personal belief. But I think that those conversations need to be had at the state level. That is beginning to happen, and also other options for how to do assisted some outpatient treatment that might be able to assist in the situation. There are a number of things that are being discussed on that level. And a lot of states have a very different approach from Oregon. Every state, pretty much. But the way that imminent has been interpreted is extreme here, and so
Yes.
yeah.
Okay.
So
Thank
All
you
right.
for sharing your experience, and I'm sorry that your brother and your family is going through that.
Thank you.
We have time for maybe 2 quick ones, and then we're going to have a short break and come back and have our second panel. I know I could stay engaged in this conversation all night easily, so I know we're going to have, it's going to be hard to break away.
Indeed, it is. First, I want to say thank you. I believe that I have come across both of you ladies. I work at Human Solutions. My name is Carla. For those of you who don't know, the office that I work out of is on 123rd and Powell. And so I work with a high volume of folks that live on the street. And we do come in contact with first responders very often. One of the resources that is available in Portland is Project Respond. That is through the Multnomah Multnomah County Crisis Line. Sorry, I'm very passionate about this, so I'm a little anxious right now. But I would agree that I've had some more positive interactions with officers, though we are still having interactions that are less than trauma-informed. Just recently, I had to call for the behavioral unit because there's only 2 teams of Project Response. For those of you that don't know, it's a team that goes out and responds to those who are in mental health crisis or experiencing some form of mental health lack of ability to control themselves. And so I had to call for Project Response, who sent instead the police force, who came, and this has happened more than once, where the officer comes in, and we are hoping to address this in a way that is respectful, to encourage this person to want to get help, to encourage them to want to go to Unity or Central City Concern or to receive some more help, where an officer comes in and goes, so what do you want me to do? Get them out of the bathroom? Oh, so you just want me to get them off their property? And the answer is always no. We want to see them get help. We want to see you treat them with a level of respect. Now, when it is the behavior unit, which is separate from Project Response, they send a mental health care provider, but on many of those instances, I've seen that person stand back and the officers are the ones doing the interactions. And though I have had some positive interactions with officers who are clearly getting the right training, I'm still having these interactions with officers who are coming in to cover for those in East Multnomah County who are the 4 response teams, I believe. And so my concern is that maybe the trainings are not getting far enough to our officers in Clackamas County and Washington County that are coming in to step in and support our Multnomah County officers. But also, I'm wondering what is being done to incentivize for more officers, more better officers who are trauma-informed, who are there for the right reason to protect the community, to help the community, because it's clear that there's a shortage. There's no question about it. And another thing I just want to mention is that I've also had a very difficult time with our first responder firefighters and our EMTs. I worked in the shelter for 6 months out in Gresham, and I've had many instances where someone had a real condition, and I have EMTs come in rolling their eyes, taking their time and treating these poor women with so little respect and dignity just because they are low income, because they experienced something, most often domestic violence, that put them there. And so I want to know what is being done and what can we do to hold our response teams accountable, because there's nothing worse for a social worker than to see someone being treated poorly when really what the intention was to help them.
Thank you for sharing that. I'm going to ask if you all have some quick response to that. Then we're going to take our break, and then we'll come back.
So I'll try to make it quick, because it's another big question. I will say a couple things. One is when I talk about my experience with Portland Police, I think I come from a privileged position of an organization that has relationships with police, has access to police, and also has the language to communicate the behavioral health need. I will say that some of the folks like in our housing who aren't mental health providers, who don't have that language, have struggled with those interactions because they can explain in a way that where the person feels the sense of urgency or hears it in the same way. So I agree with you. I can't speak to Portland Police or about their experience, but I can say that that's that's not an uncommon issue, is that how do non-mental health providers get the support that they need when a behavioral health unit or an ECIT, it's the crisis intervention, what's the E stand for? Enhanced Crisis Intervention Team. So that's one of the things that we know to do. We know to ask for that. That's not always available, but that we always have really seasoned mental health professionals on site. But when you don't have that, I think that you and the client are in a more vulnerable position. So I can appreciate that.
And I would say that, I mean, we have experience calling them. I'm the point of contact for my office, and when I was positioned at the shelter, it was something that we often did. I mean, we use the words mental health crisis, experiencing trauma or had been triggered and is unable to think coherently. I mean, these are things that we often practice and have trainings on, and still these officers come out, or EMTs, and every so often the firefighters, and it's just total lack of respect.
So in the next panel, we're going to have Sergeant Teague. Sorry to put you on the spot, but I think he might be able to give some information on the kind of training efforts that I know PPB is making, and I don't know if there's been conversations with firefighters and other first responders. I think that's an excellent question. I really appreciate, thank you so much for being here. Thank you for everyone in the room who's here because they care about this, and especially people who are working on the front lines. You have my deep admiration and gratitude for that. Thank you. So we're going to take a 10-minute break. Let's be back at 20 till. Please have some refreshment. Refresh yourself.
Oh, it is so hot in here.
Thank you so much.
Somebody should address the temperature.
back, everyone. Thank you. We're going to go ahead and get started because we have important things to hear, and I know people in the room have important things to say, so we're going to want to come back together for that. So the next panel is titled Vulnerable Populations and the Criminal Justice System. So I want to define what we're talking about in this context when we talk about vulnerable populations. And we're talking about people who are houseless, people with mental health conditions, and those who are experiencing addiction issues. So those are sort of that's the realm of what we're talking about at this point. Obviously, within all of those categories, you have folks that come from lots of identities, and I know there's a lot of folks with disabilities on the streets that aren't related to those things. So, that when we say houseless, that we're covering a lot of different circumstances of ways of being. But I'm happy to be able to introduce to you our panel tonight. And so that's Jason Gates. He's the Chief Deputy at Multnomah County Sheriff's Office. Thank you for being here. Sergeant Teague, who is am I saying that right? Is it Teague? Tighe, thank you. Sorry about that. Sergeant Tighe, who is the Portland Police Bureau NERT officer. And someone asked me to do the acronyms, and I said it was Neighborhood Response Team. Is that still right? Yes. And does a lot of work on the mental health stuff. And then Nathan Vasquez, who is a Senior Deputy District Attorney from Multnomah County. So Sergeant Tighe is going to give us a little bit of a framework again about the conversation, and then we'll move into panel, and then we'll have time for comment and questions.
So I was asked to kind of give an idea of the approach that we've used at the Portland Police Bureau, but more of a holistic picture of how we are changing what we do. And so I've been working in this community for 30 years. I started at Multnomah County, and I came over to the city in 1992. And there's been a lot of changes in 30 years in the way we do business. And I would say in the last 2 years, a significant change has been a significant collaboration between mental health professionals and law enforcement. We've always been out there together, but we've been on parallel paths historically, and trying to do the work that we do, but those paths didn't intersect very often until there was a disaster. And what we've come to realize is it might be better to prepare to prevent the disaster. And so we've really done a lot of work in first building trust between social service workers and police, dogs and cats. So there was that relationship building that had to happen there professionally, so that we started to understand, the paradigm, the frame of reference, and the paradigm that we're working through. So that took some time to build those relationships, those professional relationships. It's like any professions that you bring together. And so as those partnerships developed, we started getting there were struggles, there was mistrust on both sides. And as we started to build our relationships, we both got better at doing what we do. And I would say since 2017, we've really started a concerted effort in working together and planning and an intelligent process that really is data-driven, and we use decisions that are best practices, not just here in Portland, but we talk about it and slow down. And the two big words I'd have to say that has changed in my career is we slowed down. And by doing that, you can really avert some problems. And like every Friday, we have a conversation with mental health workers and police and other emergency providers. Fire can be on there sometimes. It depends on what the problems are we're trying to work on. But there's 50 to 60 professionals on this call every Friday. And what we try to do is we staff cases, individuals. We talk about community concerns, about public safety and health. We talk about safety of social workers who are out trying to do their jobs and their concerns, and outreach workers. So these are all topics that we work through and try to come up with a balance that works, that everybody can work with ethically and moving forward that makes sense to them. We do that every Friday. It's been very successful. The other part that's been a big change for us, for me professionally, is We finally got iPhones, and they're only iPhone 6Ss, but we got iPhones, and I have on speed dial outreach workers who bail me out, just to be perfectly honest. People who are skilled, and I'll be dealing with people that are that are houseless, that are victims of serious crimes, and they frequently do not trust me. And so I can bring somebody in that has built that rapport, and when the outreach worker trusts me, that bridge can get built. And it doesn't always happen, but it's an important piece moving forward in law enforcement. It's something we haven't, like I said, I've been at it for 30 years, and that's a huge change. So that's kind of the holistic piece that I've experienced. I am the neighborhood response team sergeant in the East Precinct. I want to say that my experiences reflect what happens in East Precinct. And East Precinct has got different issues than Central Precinct and North Precinct. There's different dynamics. It's a different community. So a lot of the things I talk about are from that frame of reference. So I would, if you give me some patience with that piece, that's my frame of reference.
Thank you very much. Chief Deputy Gates, would you say a little bit about how you intersect with this issue? And I'm also interested, if you can, to talk about any of those kind of collaborative relationships that you all are engaging in around mental health providers and addiction services.
Yeah, certainly. Good evening. Actually, I'm really glad to be here and talk to you about the different things that the Sheriff's Office is promoting, mostly in our jurisdiction, but we definitely are working very closely with the Portland Police Bureau and also the Gresham Police Department in reference to working collaboratively so that we're not moving our homeless population around. That's not what we're about. What we are about is treating this vulnerable population and community with compassion, dignity, and respect. That's something that we go into the front end of the conversation with our homeless individuals and try to work on a case management basis with them to identify the underlying causes of the homelessness. So we're trying to, we don't come in leading with you're trespassing. That's part of it, or the community tension that may be caused. That's part of it. But we're coming in leading with, why are you here? And what is it that we might be able to help you with to bring you out of this situation if you want to be out of this situation? And so far, so our team is, it's an acronym, it's HOPE, and that stands for Homeless Outreach and Programs Engagement. And so we put together the HOPE team mid last year, and one of the primary marching orders that they were provided was make relationship with the service providers. Find out who those service providers are and start building relationships. And we had evidence-based experience that's really beneficial, because for us, for the Sheriff's Office, that our introduction, if you will, into starting to work with service providers was with Join several years ago. And it was a muddy relationship at first. We weren't sure how to interact with Join and what they wanted to do. And so we kind of stepped back a little bit and through the process of respecting their process, developed a relationship where we were involved as a team with Join and actually housing a lot of people. And that remains today. We're having several successes. Our HOPE deputies do things as minute as recontacting certain homeless individuals that can't get an ID to get a job, and we will follow up with them and even drive them to where they need to be in order to help them do that. So So with that marching order to develop these relationships, they've done a fantastic job. Too numerous to mention here, but it covers the whole realm of housing, shelter, mental health treatment, addiction services, veterans, and just getting people. Sometimes it's pretty simple, like getting an ID or getting them into a shelter. But I can tell you that no one size fits all in reference to the diversity in which people are living outside. And so, some of those folks want to be there. And, we try to respect that as well. That's the most challenging part. It's kind of like, what, you want to be here. And, so we try to encourage that relationship so that they can do that in a manner that reduces that tension with other community members. And so we encourage low impact camping. We encourage getting permission before camping on private property. And, we have our process in reference to public property. I'm gonna say it. So far, it hasn't been wildly received well, but I think there's a concept that in reference to this overall challenge, I believe that if there was property where camping could be legal, and that would be a good thing in reference to helping everybody that is doing services to help these folks. When we're moving them because for trespassing issues and whatnot, we can't then track them down to help them again. It makes it very difficult. Anyway, that's what we're up to. But we have a list that keeps growing in reference to the different services and the different the diversity and multidisciplinary services that we're working with.
Thank you. That's a lot. I didn't know that. Nathan, do you have an honorific? Is it Senior Deputy District Attorney? That's so long.
Yes.
Is there an acronym for that? Sorry, no. Not Nathan Vasquez. You're with the District Attorney's Office, so
yes.
Where do you intersect in the public safety world, and what is going on with you folks over there in terms of how you're looking at how vulnerable populations are interacting with the public safety system?
Certainly. So I've been a prosecutor, a deputy district attorney for 18 years, and during those 18 years I've seen a lot of evolution within how we deal with the vulnerable population. I've been very fortunate in that I've worked under Michael Schrunk and now Rod Underhill, and both were innovators and continue to be innovators. And Mike Schrunk really started that out by doing what we call the community court process. And really that was an opportunity to where we started to come into contact with some of the most vulnerable parts of our population and seek to find ways, instead of going, hey, let's just go right to the jail option or that, we look at ways in which we can find ways to have their cases dismissed through either engagement with social services, with engagement in sometimes community service, depending on the individual and their needs. And through time, that's really evolved, and Rod Underhill has really taken a strong lead in working with the courts, particularly with Judge Waller and with some others that have, they have a really strong vested interest in seeing how can we do it better? How can we serve these populations in a way that makes sense? Because, to be very frank, the criminal justice system and the tools we have, they are not well suited to deal with the mentally ill population. They're not. They're from all different phases of our criminal statutes, whether they're the lowest level misdemeanors up to felony property crimes and things. We make every effort to try to take that tool we have and look at how can we develop that in a way which can serve both the community, the victims, and that vulnerable individual. One example is our Multnomah County Justice Reinvestment Program, or MCJRP. That's one where we have really looked to, and we've been fully invested in engaging with the courts, with the defense, with our parole and probation. And what we do is, prior for people that are facing prison time, and oftentimes we find individuals that have serious mental health issues that may be facing prison time, we do an extremely thorough evaluation. And before we put them into prison and do that, we go through just line by line with a defense attorney, with them, with a judge, and we look at carefully, like, what is this person's underlying issues and how can we best address that, really for the safety of the community, for the long-term benefit of that individual. And oftentimes what we hear from the victims that we are charged with serving is most of the victims are saying, I see those issues in that person. I don't want that person just to go right to prison. What I want is to see them helped. I want to see them to be in a better place in life. And so the District Attorney's Office has really strived to evolve and to seek out partnerships to get to that point. And we look at that from the misdemeanors on up to a lot of our felonies that we deal with.
Great, thank you. So we hear a lot about 21st century policing, and for those that don't know, and correct me if I'm wrong, but there was a panel that President Obama put together to address the tensions and crisis in policing across the country, and really look at what were the ways in which the institution needed to change. Do I have that? Does that seem like a fair? And so they came out with the 21st Century Policing Recommendations and Report. I encourage you all to look at it. It's a very interesting document. So I know that there's been I know that Chief Outlaw embraces that guidance a lot. So I'm wondering, how have the expectations of your work changed or expanded with respect to vulnerable populations under that sort of direction of really shifting the institution to serve the people that are now here?
For me?
Mm-hmm.
The processes that came out of the Mr. Obama's study is a lot of that is dependent on it's data-driven decision-making. So it sounds kind of cold, but it's really not. It's about using data and research to understand the communities that you serve, and to understand, and then to look at the community and find out what the real needs are. And it goes back to what the commander said. There's not a one-size-fits-all model, and the tolerance in different communities is going to be different to what we do, and that includes these vulnerable communities. These are communities, and we need to learn to deal with these communities. And there's a community safety piece and a community safety concern in the houseless population. They have community safety concerns they express to us, and they are in a unique situation that when they express that, if we are unsuccessful in solving that problem, they are left out there in that situation with the person they just talked about. And that's a difficult situation for them. So that also makes it very complicated for the police. And that goes back to what I was talking about. And this is kind of what the 21st century policing model means to me, and it has been expressed to me, is we slow down. Okay? When there's an emergency, we go fast. But if we can slow down, and there's room to slow down, you slow down, and you make good decisions. And there's to illustrate that, we have one community that they like to see police lights. They want to see us out there, and they're very expressive about that, and they're very specific about that. I have another community that I serve. They don't like that. They don't want us to do that. So what I've learned over time, and what the expectation is now, and has been for some time, is we listen to the community. This is what community policing is, and we adapt to the needs of the community, and do the policing in a way that they want it, because they live there. And that includes, and I keep re-emphasizing this, is I know that there's this accountability piece that people talk about in the houseless community, and there's accountability out there, and you have to remember that houseless people are victimized, just like anybody else is victimized. They do not have diminished rights because they don't have a place to live, and because of that, they don't call 911 as often, and they are worried about calling 911 because they become a different person out there once they do that. And so what they have to do is they got to rely on the fact that we don't just come out to arrest them. My guys, like on my team, one of the things we do, Central Precinct does this, I think North does this, I can't speak to it specifically, but we go out and we just talk to them. We do welfare checks. We roll through on ATVs in our cars if they're in a place where we can reach them, and we talk to them. So the conversations we're having with them are not, hey, I want to see your ID. They know us by name, we know them by name. And what that enables them to do is sometimes they can text, I'm having a problem, I need some help. The outreach workers are super critical in this piece. Once we've established trust, they're not as worried about naming names, and they'll tell us, hey, this person is doing this or that. This guy just assaulted his girlfriend, and then we roll through on it looks really like we're just doing what we do, and we run the guy's ID, and he's got a warrant. So we take the guy away, and his girlfriend's not going to be beat tonight. And there's been times when we've gotten there too late. And, you know, and that's kind of the nature of the world they're living in. It's rough. So because it's rough, we are trying to adapt, and we are coordinating with social services. We're coordinating with the DA's office. We're coordinating with people we've never worked with before. And I think that's what's changed, is this, we're just slowing down. And there was a couple that was in a car. They were caught stealing, and they were addicted, and they had money to get an apartment, but they just didn't want to do it for whatever reason, okay? They had an individual situation going on. The caseworker, or I should say the outreach worker, I'm using sometimes improper terminology here, but the outreach worker gave me the lowdown, and she said they need to go inside. They can afford it. And they've turned one down already, and we need to encourage them to go inside. And neighbors wanted the car towed. The car was broke down, so that you have all this conflict developing around these people. And the decision was made that probably we're going to tow this car eventually. It was a broken down car. They're in violation of the law. There were some problems happening, but we took 2 weeks to do it. And we got them a place to go first, because the problem could be solved in 2 weeks. It didn't have to be solved on Monday. So that's the difference. And they had 2 weeks to think about what the sergeant told them. You're gonna have to make a move. And we're just gonna. So we kept coming back. We kept talking to them. So the most stark example I can give you is what changed. We don't just go in and you gotta get out of here. You know, it doesn't work like that. You know.
Thank you for that. I think we bit out more than we could chew tonight, because we're already getting to where we want to open up for public comment. We haven't heard enough from you guys. I apologize. But I'd like you to briefly cover just one. I'm going to mush these questions together, also called summarizing, and ask you, where do you see the need for more change, and what kind of support do you need to get there? If each of you could just speak briefly to that, and I'd like to start with you.
Sure. So the sheriff doesn't want to house mentally ill people in our jails. We don't, as law enforcement officers in the field, deputies, we don't want to have to arrest people who are mentally ill or experiencing mental health crisis. I had I really appreciated what the previous panel had to say in reference to that. What mental health services are there are good, but it's too few, and they're not robust enough. And the whole concept of, you know, if somebody's not able to, if they're in a mental health situation where they're not able to feed themselves, isn't that an immediate crisis? Yeah, right. And you know, so I appreciate what they had to say. You know, we will find somebody that is definitely a danger to themselves daily, and you know, and we're talking about people that aren't able to not run into speeding traffic because of their mental health crisis, are not, they can't dress themselves for the weather, or they're not dressed at all for the weather, that we take on a police officer's hold because they're a danger to themselves, and 4 hours later we're dealing with the same person in the same spot that we picked them up 4 hours ago. And the question is how and what support you need from us. Oh, sorry. So, yeah. Well, we need to have the ability that those folks. There's something in place that provides medical professionals to be able to make decisions in reference to that person's care when they're not able to do it for themselves. That's what we need.
Thank you. Thank you for that. How about you, Nathan?
I'm going to bite off way more than I should here, but I'm going to take 2 points, because while we've been talking a lot about the houseless population, the other part of the vulnerable population that we haven't really addressed are some of the drug-addicted individuals that we deal with. And one of the programs I see that is an amazing example of collaboration is Emily Rashawn's program with the Service Coordination Team. They deal with individuals who are both dealing with houseless issues, with substance abuse, and with what we call criminality. And they seek really quickly to assess that individual and to find housing for them, to connect them with treatment, and do that. And so, what we need, quite frankly, is more of that. They have a full caseload, and they have a lot of fantastic people working, but we need more of that because the need of individuals out there is so much greater than what they can currently take. And something that is, I think, a good point of discussion that has to be out there that hasn't been, and it may not be the most popular point, but is there also needs to be a backstop to that. And the backstop is that there are individuals that are what we call service resistant. And it's hard to say, and it's a hard thing to talk about, but there is a need for that. There's a place for that. It has to be carefully evaluated, and certainly we lead with services, we lead with treatment, we look for that, but without a backstop, and that backstop, quite frankly, for individuals with drug addiction issues, sometimes is jail. It has to be. We have to have a backstop. I'm not saying that's where we lead and start, but when you have that, and you have the ability to work with individuals on an ongoing basis with a true understanding that addiction does have setbacks. Addiction does mean that people will have relapses. Absolutely. That's all part of it. But in that framework, we have to have a full conversation about that. And quite frankly, we have to have an ability to do that, which currently we don't. We struggle very hard right now to keep in violent felons. And that's a struggle that we deal with on a weekly basis. So that's a big piece that's there. And then the last thing I'll say that we need to change, which was discussed in the other panel, which is there's a massive gap between what we can do with a civil commitment and what we can do with jail. And jail is not, as I've said, and the criminal justice system is not well suited to take care of individuals with mental health concerns and issues. On the other hand, the civil commitment procedure is so stringent that there's a massive hole in the system, and we are not serving the population. We can all go outside and walk around and see individuals who are not being served, and just from my own personal perception, there are people living in absolutely inhumane conditions on a daily basis in our community. There are our brothers, our sisters, maybe some of our mothers, and what we do is currently inadequate, and we need a change in the law. We have a statute called the assisted assisted outpatient treatment statute, which is kind of designed to get to that middle ground, but it's currently not used. It's not well suited how it's written, and it needs to be redrafted. It needs to be changed. The law needs to change. So what we need, and what I hear from the business community, what I hear from the residents that I work with regularly in the downtown corridor is we need a change, not just for us, but for that person on the street. To call ourselves humane and to look at those individuals on a daily basis, they are less concerned about what is a big impact on their lives and more concerned about that individual who's walking on the street.
What's the name of the law?
Currently, it's the assisted outpatient treatment, and it's a set of statutes. I mean, it really is.
So line up for the next legislative session on that. So we had, thank you so much. I'm sorry it's such a short period of time. Thank you for giving us some concrete ways that we as a community can try to move some things forward. I saw you, Philip, and where did Mandy go? No. Oh, Mandy has the lineup. I'm sorry.
Bit of a queue starting. So we're going to start with the person who didn't get to ask her question at the end of the last.
Great.
And then I've got Ada had raised her hand and the gentleman in the red.
Okay, and it's going to, yes, and we are short on time, so I'm going to ask people to be as brief as possible so we can get as many people as possible. Thank you. Right. Okay. So, are you in the lineup?
No, she asked her question. She was the last questioner before.
Okay. We will stop in time to get that question answered. Thank you.
Okay. Hi. My name is Caitlin. I organize with Western Regional Advocacy Project. And I guess first, are you familiar with Western Regional Advocacy Project at all? Our acronym is WRAP. So very quickly, we're a regional coalition. We're based in San Francisco with chapters in California, Oregon, and Colorado. We work on the Homeless Bill of Rights campaign, which is an anti-criminalization campaign to fight against laws that criminalize homeless people and specifically negative police interactions. The chapter members here in Portland are Street Roots, Sisters of the Road Cafe, and Right to Survive, which I'm sure you're probably more familiar with. but we all work together in coalition. And I think one frustration I'm having personally with this panel, and I think a lot of RAP members would agree with this, is everyone on the panel is a part of law enforcement. And we definitely agree with what you're saying right now, that there needs to be more of a conversation right now. But we need people who are unhoused at the table, who are talking about their experiences directly. And so that's just something to be a little self-aware of. But I did want to talk a little bit about responses, police responses to homelessness. I know, especially you, Nathan, you were saying that law enforcement and jails don't really have the skill set needed to address mental health crises and homelessness. And
what I said was they don't have the tools, which is different than the skill set, but that's...
Yeah, the tools, sure. Well, so one thing I would say, would any of you be willing to kind of take a step back sometimes, and instead of having police responses to these crises and having more training, maybe delegating that task to people who are already doing that? For instance, I know there were examples brought up, people, I forgot who said it exactly, but they were saying that it would be good to have places where people can safely and legally camp. And so would you support more villages like Right to Dream 2 and Dignity Village and what was created, Village of Hope, but has since been swept? Would you support those kind of opportunities where it's actually being led by people who are living on the streets, and kind of take a step back and let them take that direction rather than trying to figure out which ways you can intervene? That's all.
Okay, is there a short answer to that?
Well, I said it, so yeah, I would support that. But
I support a solution that's safe and supports the community. So,
yeah, with community involvement and discussion, yes.
Thank you. Thank you. Mandy, who do you have next on your...
Ada is next.
Sorry, I'm pushing forward so that we can...
I just wanted to ask a little bit about the law, getting back to the law again with the DA's office and also with the partners that you guys work with in the community. I see that there's a lack of following up from what she just said. The community involvement with going out to the homeless and trying to intervene. My concern is that when you approach a homeless person in a blue uniform, or if the lights are going off, that's a danger for a lot of them. And so what I would like to see is if there's a different approach, that when you go out and you have the providers going with you, is it possible that you can wear a different type of a uniform? Something different that looks more casual, you know, like you're out there and blending in with the people versus, you know, badge and, you know, all the gear and, you know, that type of a presence that would probably help the homeless. The other issue is with the law, dealing with the DA's office and working with the correctional facility and the programs that you have. I find that there's a lot of barriers out there to those programs. You have to fit into the glitches or the criteria that you create, which leaves out a lot of people getting into those programs. So I'd like to see something to where you could work more with the community on developing better programs for people to get into, for them to get the treatment. I know that there's not a lot of treatment right now going on out there. A lot of people don't even get in. So I know that's an issue now, and I know that a lot of the programs that we have in the community, there's not enough programs. We don't have enough of the providers that are out there, so I would like to see more of the advocacy, more of the nonprofits be more involved to where they can go out and help, you know, to be a bridge. And then too, as far as the services, and this is my experience, a lot of the workers that are out there that do the work, and even case managers, I know we're lacking a lot, but I see that there's still an issue with cultures, having an understanding of serving the needs of the cultures. And even some of the providers don't really understand what a person is going through. And so without a person from the community or someone who's familiar with that individual, who knows what's going on with them, it would make it easier to work with them so that you could get an understanding of how to approach, what to say, what to do, what their needs are, and then how to treat. A lot of times our cultures are treated improperly. That causes more problems. And it causes more addictions because now they're on all these opioids and they've been on them for years. And so now, you know, we have this impact of what the cultures are going through. And then if you put them in the jail, you know, I mean, that's double jeopardy to me for a person being in jail, which is why we have so many people that are on the streets now, like what you were just saying. It's inhumane for them to be out there that way. I was sort of shocked this weekend in the neighborhood and saw a person walking down the street with no shoes on. You know, I mean, they had on regular clothes, but they didn't have shoes. So I was sort of struck with that, but I don't want to go on forever.
Thank you, Ada. And that was a lot in one. I just want to summarize to say, you know, I'm hearing a lot about connecting more with the community. I think all of Multnomah County and the city of Portland have made equity commitments, and I think using a robust equity lens so you can look at the needs of different communities based on where they are is a tool that's available, and I'm sure folks are beginning to utilize it. So I'm not going to take more right now because there's other hands, but so let's get the rest of the questions. And I definitely the question that was left hanging was training, correct?
Training, accountability.
Right. So we'll hear what those efforts are. But Phil, who was next? Mandy, you're in charge. You be the boss of me now.
So kind of to touch on what they said about the whole like format on how this goes, I was wondering where are the actual like sit down meetings where people like the community and officers or whoever can sit down and actually have a just conversation and talk. It seems like there's a lot of programs or whatever that are hosting equitable stuff or whatever. I don't know any about those resources, where those are at, how those are going, and along with just with I'm a part of some other things where it seems like the same thing, like we meet with police officers, but they talk, somebody talks after them, then it's our turn to talk, and then just it's never a clear, direct path. So yeah, where are those things at, and how do we get those? Also, to go back to what the person that works with the DA's office said was it needs to be a backstop or backdrop or whatever. I feel like we all agree that in certain situations, yes, jail is the place. I think a lot of us come together for the part of understanding and training on the times where, yes, that is a situation that needs to happen, but an officer might take it to violence and something further than that to where the person doesn't get to make it to jail. So, like, what exactly are the policies to keep you guys to make sure that people are getting to go to jail and not cemeteries or other stuff? And just how do we get informed on exactly the laws and policies? Because I know I was caught off guard once when I saw that there is a protocol for the cops to go through to de-escalate situations, and one of those things are taking it to deadly force. But to me, that was never told. So I was arguing opinions against facts. So where's more resources on the protocols that the police take to handle situations that way we're not just yelling stuff at you guys for no reason, even though you guys are just doing your job like you said. So, like, how do we find the policies of your jobs, and how can we change those or work with you guys to go against whatever's holding you guys back up from doing whatever needs to be done for the community?
Thank you for that. I'm going to ask Sergeant Teig if you would answer that, and also if you could wrap in the training piece to talk about I mean, I know you're doing de-escalation trainings, implicit bias trainings, mental health, that kind of stuff. So if you can quickly say what's happening and then specifically answer the question of how can people connect when they want to be in conversation, and where do they find the resources to fully understand the policies of the Bureau? Yeah, and that was the last part that I hoped so how can the average person figure out what the policies are on these issues? Yes.
Oh, okay. To address the where can you have the sit-down conversation that's less formal, there are neighborhood associations. That's one format. A group called Renew is East County. You can get that in the Rosewood Initiative, which is kind of out of 162 in Stark area, and it's there, and you can participate in a much more informal conversation there. And then there's East County Cares, does conversations. It's a similar format, but it's a little more personal. And it gives you, there's a piece of time where you can sit and have a face-to-face conversation with whoever you want. And so you can have that informal piece and ask the questions. With regard to training protocols and policies, Portland Police Bureau it's published online. So you can go see what the actual rules are and what we're supposed to do and what is an appropriate way to approach things. It's not drilled down into long stories, but it gives you a framework to look at. And the young lady in the back, could you clarify your question?
Yeah, I think I misunderstood. Can I just ask one question? Are people willing to stay 5 extra minutes so we can get the question answered? And there's a gentleman up here who's been waiting a long time to speak. And Nicole wanted to say something about public involvement. People willing to stay? Okay, great. So let's get back to no, we're not taking more questions though, but.
Portland Police Bureau. It's just Portland Police Bureau. Yes. .gov.
Mm-hmm. Right. So I thank you, Mandy, for helping me understand the part I missed about your question. Can you say it in one quick sentence?
Yes. So, for instance, I believe that you slow down and are somewhat more trauma-informed than the rest of the force. But for East Multnomah County, they're understaffed, so there's no time to slow down. And so then there's no time for them to be trauma-informed. And I'm asking, what is being done, or what is a resource for social workers like myself when we're put in these situations where we see people treated without dignity and respect, to hold those responders accountable? And also, my main question apart from that is, we are understaffed and they are burnt out and they are not being trauma informed always, most of the time. So how are we incentivizing our younger community to want to join the police force, to be better cops, to be out there helping the community? Because I believe that
I think you got it. Thank you.
Thank you.
So,
so
in 500 words or less.
Yeah, I'll try to get. No, I'm going to really drill this down quick. Relationships are the way you're going to do that, because the big elephant in the room is there's not enough police officers. There's not enough training. It's time, money. There's a time and money resources. So what you need to know is how can you work better with what you have on hand. The tools that you currently have, how can you make those things work for you? And what I'm learning that's working well is establishing relationships, because you need to be able to have a conversation with someone you trust, right? So I have an outreach worker that if she sees something that she's like, I didn't like that, I get a phone call. And sometimes if it's a policy violation, it's pretty clear. I just report the policy violation to the supervisor, this person's supervisor, and it's dealt with. Sometimes it's just a maturity issue, I mean, I've been around 30 years. Just by nature, I'm slowing down. So it could be just a training opportunity for me to talk to an officer or something and relay a message to someone that's trust me, but may not trust the officer. And one of the things that have happened is I brokered these conversations where they went and had coffee and had a conversation that kind of went, the officer I probably could have done that better. And there's that, breaking down that pride piece. There's a pride piece, I think, that needs to be broke down. So the quick answer is you need to build relationships. It'll be harder probably for you to do right away, to just set aside that fear of what the officer's going to do. And you can start with someone that, like you say, you think that I would listen to you. You start with someone like me if it's my police department. Okay.
Okay, so thank you so much. So Nicole, I'm sorry, Philip, we're not going to have time to get to that question. We have... Right, and because we were going to cover Nicole Grant wants to say about community involvement. This gentleman's been waiting since the beginning. Would you go?
I will make this as concise as possible, and I'm going to try not to sensationalize it, but my name is Brandon Eisen. I work for FM News 101 KXL, and I've spent a lot of time down in Old Town. I have my personal office there at the Everett Microlofts. My personal observations over the last couple of months, including today, I'll start with today. I went to PAIR, which is a youth mentoring, and it's down there. And you say, we need to put all these people in the same place so that you can give them the resources. And what's ending up happening is there's the predatory criminals. You know, I go there. I've gone to every business in my neighborhood in Old Town. I've gone to every tenant. I've gone to Pear. I've gone to several places, and I have the recorded audio of everyone saying how terrified they are to be down there. And we expect our youth to go down there for a mentoring program. So there's that observation. And just a little background on me. My mother was the first female police officer in Yakima, Washington. She became a sergeant, hired most of the guys that work there now. My stepdad was a child sex crimes detective for 5 years for Yakima County and a homicide detective for 10 years. Then he was the undersheriff. And Karen Irwin decided to stay on a few years, so my stepdad left and became the director of the county jail. So that's a little background on me. Now, the other thing I need to say is I'm no George Zimmerman, and of all the calls I've made and all the interactions I've had, I've never touched a single person out there. But I have record of the 911 calls that I've made, and I'm being dismissed. First off, it starts with the 911 operator. They're dismissing me right away. And I'm only calling. I've only called about 10 times in the last 3 months I've been down there, and I've observed a lot more than that. The times that I do call is when I feel that my community is at risk. I feel that I'm in a safety risk. And when the police do actually arrive, and I'll follow the guy because I'll help you guys keep an eye on him till you guys can arrive, right? Keep a safe distance. But you know, the second they tell me the cop's arriving, I let the guy kind of go around the corner and back off a little bit. They pull up and I go, he's right there. I'm the guy who called. He's right there. What they do is they do a U-turn, stop and get out and want to talk to me for 10 minutes before they even just walk over and do something. Besides that, one example, a guy was in the street, and I'm getting to the mental health issue. There's a guy in the street waving a knife, and I called 911. They arrived and they said, well, what do you want us to do about it? Do you want to press charges? We'll do something if you press charges. But otherwise, and what has he done to you? Did he threaten you or whatever? So they were dismissing it. Not only that, but the people that I felt were violent, whether it be from mental illness or from them just being upset at me because I didn't want to give them something and threatening my life, and they're not going and following up and just checking on these people and seeing what's going on with them. And I apologize, I am a little bit passionate about this. I've been affected, and you're right, you do become a target. I have a $25,000 truck that all the tires were slashed because I called 911. The cops laughed at me. The people I called 911 on laughed at me and said the cops aren't going to do anything, so they came back and did that. I'm getting kicked out of my office because I've developed verbiage on the street at 3 o'clock in the morning when someone is you know, threatening me, where I feel threatened. I say, I feel threatened, do not come a step closer or I will defend myself. And I have a loud voice. So 2 times the landlord has gotten an email saying, oh, there's a guy, that guy's yelling on the street, when they're getting only part of the story. So I'm getting kicked out for that. Besides that, there's that youth element, and I'm gonna go talk to the lady that I talked to today in more in depth. I've got 7 pages of my observations over the last 3 months down there. And I'm tired of being dismissed. I mean, there's some real issues down there. There are homeless people that I speak with that are leaving the area because daily they are robbed, their SNAP cards are taken from them. You know, the predatory criminals that are selling them drugs, you know, we offer them places to go. They don't want to go because they have a market and they want to stay there. You know, so we have to find, you know, a middle ground where, I mean, we can't do, obviously the Pacific Northwest is not New York. We can't do the broken window policy and just nab everybody up. There's too many issues and we care too much about our community. And by the way, I have a lot of respect for you guys, but I need to figure out what we need to do to change and how to get this out to the community and get everyone to participate.
I want to thank you for bringing that up. This is something we hear from folks all over. I think this is a point of attention. Thank you.
Can I say one sentence before I go? Yeah. I have hundreds of photos, documentation, audio, everything else, and the police, when I try to show them or anything else, they just dismiss me. And I've got all their cards, I've got all my 911 calls documented, I've got everything else, And I'm sick of it. I'm done. And in 2 weeks, I'm doing a major crime series on FM News 101 KXL. And I honestly would really like a little bit of cooperation before I do that and find out really what's going on and what the next steps are.
Can you connect after the meeting?
Yeah.
Okay,
Thanks.
thank you. Nicole, there was something you wanted to say about community engagement?
Yeah, are we done? We had two other people who had questions, Philip and a woman back here in the middle. Are we, and just, I defer to you, Judith, because I know we're over time now.
Right. Well, we have 4 minutes left of the agreed upon time to stay. And I don't want, this would be the final time, but if we can just take those two questions, but I mean short and concise. If everybody can do that, because it's also really hot in here. The Bureau of Sustainability is on the 8th floor. They need to be notified this is unsustainable. We're all like, okay, I know, and I'm sorry, we're just not going to have time for everybody, but quickly, Philip is going to ask his question. And then one more that has been in line. I'm sorry, I know it's frustrating.
I would like to ask for the opportunity for other people to ask their questions, extend the time. But this is for Teague. And for President Obama is no longer in office. I want to discuss our current president, Trump, who announced on TV that we encourage the police to beat people and to use physical force. And this is prevalent in police culture all throughout the U.S. In 2017, the UK, 4 people were killed by police officers, while in 2017, the United States, 1,188 people died due to police-related deaths.
So, Philip, I'm really going to ask you to make it really brief.
Hold on. I'm just wondering, okay, what I'm wondering is in regards to police culture, because not all police officers are required to take de-escalation training or mental health training. Not all of them are required. So how can you really prove that we are safe when the police are interacting with vulnerable communities? Can you explain that?
So at Portland Police Bureau, we are all required to take the training that you're talking about. With regard to national politics, the Portland Police Bureau is ran by Chief Outlaw. So that's who we respond to. So we follow the laws of the state of Oregon. I really don't have any opinion about these federal policies, or I work for the city of Portland. And as far as building trust, I don't know if, are you from this community originally, or are you from someplace else?
Well, I've lived here for almost 10 years.
Okay.
I live downtown. I've seen the police every day where they have inappropriate reactions.
Right. So I just want to, this really has to,
it goes to training, and it goes to culture. And those are the things we're working to improve all the time. And a big piece of that, I think, is going to go back to what one of the mayor's staff would like to talk about, and that is the community involvement piece. Because to deliver the service the community wants, we need involvement. And we're not going to get there without involvement. So if there are people in the room who have trust issues with a police officer, if you have a person that you trust that doesn't have a trust issue with the police officer, then you work with that person to work with us. Okay? That way you can get introduced to someone that you might eventually like to work with. But you're not going to be able to do that if you just don't engage. So if you have a person that you trust that is already engaging, work with that person to find out an officer that you can work with. And get involved, a little piece at a time, small bites.
Thank you. Now, I just need to, you said there was one other person that had a question. I'm wondering if this question could get answered for someone after the meeting, or do you want to, okay, is it? Okay. Man. And Nicole, why don't you come up here to do your part?
I appreciate what everybody said here, and I agree with a lot of it. I just want to make another statement, though. I think using a gun in close quarters, like when the police went in with Elfrid's, is very dangerous to everyone. And there need to be in an apartment building, on a street where there's a lot of people, guns are just too dangerous. And so there needs to be some, I don't know what alternative, but there needs to be some other alternative. I personally have twice shots were not fired, but I was in the line of fire from a police officer pointing a gun at somebody else by accident.
Thank you so much for saying that. Nicole's going to Can we have the mic?
Of course you can.
You can have my mic. Sure.
Take a mic.
Hi, I'm Nicole Grant with the Mayor's Office. I want to thank all of our panelists for participating tonight. We really appreciate your time. Thank you all for attending. In response to the question, I'll keep this very brief, but in response to the question about community involvement, I wanted to flesh it out a little bit more. So one, on the point or topic of directives or policies, if you go online, you can sign up to get notifications for when PPB policies are being universally reviewed, which basically means they're open for public comment. So that's point one. But two, more immediately, PSEP. Applications are due July 2nd. If you are interested in actually sitting down with PPB, like at a table like this, in a room, and hammering out policies, not just those related to the DOJ settlement agreement, but honestly, anything that concerns Portlanders, please apply. We absolutely need you. Applications are open until 11:59 p.m. on Monday, July 2nd, after which they will be closed and you'll have to wait for next year. And so we know how many people, just based on the turnout tonight, are absolutely interested in having these conversations. But if you want to do more than just listen and have a group of experts talk at you and then you talk back and there's really no interaction beyond that, then we need your participation on this panel. There are hard copies of the application by Mandy, but you can also go online to portlandoregon.gov and download the application. There's also an online submission form that you can use as well. You just need to be 16 or over, live, work, worship, or attend school in Portland. Mandy, am I missing anything else for criteria? Oh, yeah, you can't be a city employee. And you cannot be a city employee. And that's it. Thank you.
Thank you, everyone who participated tonight. I'm sorry we didn't have more time. Appreciate everyone's care for this. Thank you guys for your participation in the panel. Sorry.